Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, today I am discussing a very serious matter because this matter, many people will raise their eyebrows and say, ah, this much emergency you can treat in Ayurveda? Because the title is penicillin reaction. Actually, there are some allopathic medicines which can cause a very serious or the danger complications or the side effects of that medicine as like a anaphylactic shock. The patient can have a very serious side effect when they are especially injectables. For example, three or four important names I would like to mention. First is a penicillin medicine. Second, the medicine is a iron injection, which is called as Imperon. And third injection is a B1, B6, B12, that is Polybion or the Neurobion. In this Polybion or the Neurobion medicine, there are three vitamins: vitamin B1, vitamin B6, and vitamin B12. Among these three vitamins, only thiamine or vitamin B1 can cause serious side effects or the complications. And these side effects or the complications are so serious that even the patient may die. So, before giving such medicines which have proven their what you can say the allergic type of reactions, they should be used very by expert doctors and very cautiously. These injections are given after sensitivity test. Please remember my words: AST, after sensitivity test, or after test dose, ATD. So unless and until you have tested these medicines like for example penicillin, Imferon, iron injections, and B1, B6, B12, especially thiamine, that is Polybion or Neurobion, these type of injections are good injections, are not bad injections, but they have a very fatal type of the complication or serious effects. Now, when these reactions occur, there are different types of reaction: mild reaction, moderate reaction, and severe reaction. So to begin with, of course, you have to call the 108 ambulance, and also you have to call for expert doctors and a team. But basically, sensitivity reaction test should be done in the hospital, according to my opinion. And if it is when it is okay that the patient don't have any allergy for penicillin, don't have allergy for the Imferon injection, don't have allergy for even, I will explain the two new names. One is a Voveron, dicyclophenac sodium. These medicine also can cause the side effects or this type of the anaphylactic shock or serious reaction. And another example is xylocaine, which is used for the anesthesia purpose. So my dear doctor friends or the students, please be cautious about these proven medicines which can cause anaphylactic shock. But just to give some idea that in emergency, what Ayurveda doctor can start with some treatment. That is the purpose of this video. It is not, I am not claiming anything that we can survive the patient's life by just Ayurvedic medicine. No, I am saying that there you can use the F-Corlin injection, or you must use the Avil type of the anti-allergic injection, or you can use the different serious what you can say life-saving medicine like adrenaline, or better way, you must admit to the hospital by calling 108 ambulance. But just to get the idea, yes, Ayurveda has some medicines which can be used in mild or moderate reactions only. Okay, but I am not claiming that these medicines 100% will save the life of the reaction. No, basically this reaction occurs when you give the medicine without testing. So always be cautious, give the medicine after testing only. Okay, this penicillin injection is basically, in my times, in the olden days, was a very popular antibiotic. No antibiotics were there, only penicillin for one and all. But basically, we were using, especially I have used this medicine, Penidure LA or Penidure LA 24. These medicines I have used for treating the syphilitic ulcer, because this is the best medicine for syphilis. But of course, it has to be given after the test dose. Special precaution: unless specifically indicated, do not use the penicillin. Example, you can use only and only such type of cases like syphilis. For syphilis, penicillin is the best medicine after test dose. Always test the drug and do not use the drug carelessly for any element. It will be better to give the test dose in the hospital where everything ICU is available to take care of the reaction if it is occurring. Okay. Now let us see what is the mild or moderate type of the reaction. What will happen? Immediately after giving even the test dose, the patient become restless. He has a lot of sweating and perspiration. He may feel nauseating and also 1 or 2 bouts of vomiting will come. Then immediately there will be itching all over the body will start. Urticarial rash will be there and edema also, angioneurotic edema, lips will be swollen, something like that. But also as per the sign, you have to check the pulse, and pulse will be tachycardia with feeble pulse. Remember, the patient is so perspirating and what you can say is in a condition of shock. Shock means the less blood supply to the brain. So always lift the leg side of the patient, lie him on the bed. Don't sit, allowed to sit or don't allowed to stand, but he must be kept on the lying down position, and that particular leg side should be raised, and you must know the basic basic BLS, basic life support treatments. Every doctor, Ayurvedic, homeopathic, allopathic, should learn the basic life-saving managements. So because these basic life-saving managements are very important. For example, artificial respiration or the cardiac massage for such type of the cases. Okay, what Ayurveda can do or what Ayurveda can make a research on this in the hospitals? Hemagarbha. This is a typical, actually, this is a wrong printing mistake. It is not chewing. We are giving always sartan. We make a paste on the hard stone and then we mix it in the ginger juice if available, or at least honey. You mix it with the honey and give the little sartan in the conscious patient. Always all these treatments is only for conscious patient. If unconscious, no chance, you have to admit to the patient. But that is the only solution. Okay. Then you can use the Chandrodaya Ras, Baidyanath company, 60 to 120 milligram 2 times in a day with honey. Again, honey is the best Yogavahi or the catalyst. Once patient is out of reaction, then also you can use the Chandrakala Ras tablet, 2 tablets 3 times in a day. Then the Mutrala Churna, that is Rasayan Churna, 500 milligram 3 times in a day. Punarnava Kvat, 4 teaspoon with equal amount of water 2 times after meals, after settling down the patient. Okay, but this is a just rough video which can start thinking of this particular reaction type of anaphylactic type of the reactions which can occur in our medical practice. Thank you very much for your nice cooperating all the time, and I wish that please subscribe my YouTube channel by folding my hands, and don't forget to press the bell button icon. I wish all the best. We will continue this series Ayurveda in general medical practice. Thank you very much and take care.